This time on Pet Medics, Max checks out a little kid with mummy issues.
Just love my goats.
Nurse Kylie faces some hard choices when she brings one of her own into the clinic.
Hopefully it's going to be okay. I couldn't bear to lose this guy.
And how many golden years are left in this golden retriever?
We want to keep her as long as possible because she's so gorgeous.
In this coastal town in the heart of New Zealand, the largest local vet clinic cares for all the region's animals, both big and small.
Sit.
Furry friends are loved family members, and their mums and dads don't hesitate to get them the best care when times are tough. As well as a 2-year-old son, vet nurse Kylie is proud mother to 6 furry felines. This morning, Kylie has brought in Willard, who has a worrying problem.
For about the past month or so, I've noticed that he's had what appears to be some sort of a growth on his nose. Hopefully it's going to be okay because I couldn't bear to lose this guy.
Kylie's cat obsession is well known amongst the vets.
She's, as she describes, a crazy cat lady. So this is one of her 6 or 7 cats, and yeah, all her cats are important to her, particularly this one is one of her faves, I think. Hey! Oh, look at him! I know! So it's been there about a month, you reckon?
About a month, yeah.
Doesn't seem to hurt him, does it?
No, not at all.
But Willard's patience is starting to wear thin.
Hey, hey, hey!
Oh, my Willie.
He's had enough, hasn't he? Is he always like this?
No. He's just a bit stressed, yeah.
And Kate has noticed another big change in Willard.
He looks like he's lost a lot of weight today.
I think the last weigh-in he was just over 5.
Yeah, 3.7 today.
Wow, so
Yeah.
that's
Quite a lot of weight loss.
1.3 kilos.
Kate is concerned about Willard's weight loss and decides to do some tests.
What we need to do is get some bloods,
Yep.
check out everything else, liver, kidneys, thyroid, all those things.
Definitely.
Make sure nothing else wrong with him,
Yep.
and then also get a fine needle aspirate of this lump.
You're a very good man.
Kylie has an unorthodox method of distracting Willard.
Like a diamond in
Good boy.
the sky.
And lastly, Kate takes a sample of cells from Willard's mysterious lump.
It's a good boy. It's a good man.
Say bye to the camera, Willie.
It's an anxious wait for Kylie as Kate checks the sample. While she's a professional vet nurse, she's also a worried pet mum.
It's quite concerning for me, and this cat means the world to me, so.
Meanwhile, another worried mother has arrived at the clinic. Local GP Catherine has brought in her beloved golden retriever Tandi.
She's a very old dog and she's really deaf, and she's here for a checkup because she started getting very short of breath. I'm just worried about her heart.
When Catherine immigrated from South Africa 14 years ago, she was ready to invite a new member into her family.
I wanted a baby, but we'd already got 3, so we decided we'd have a dog instead. She was just a gorgeous little ball of fluff. And then about a year after we had a baby, so we got them both in the end.
Hi, my name's Holly. This must be gorgeous Tandi.
Yeah.
Do you guys want to come on through? Come on, darling.
Despite Holly's sunny demeanour, Tandi doesn't want to have a bar of the vets today.
Oh, okay. I don't really want to slip slide you the whole way. There we go, good girl. So her breathing at the moment hasn't been so good.
Well, she's like this all the time. And it's okay if it's when it's hot, I understand that. But she's like this in the evening when it's cool.
Tandi's symptoms are obvious, but the cause is not.
It's the odd one that you can just hear a little extra dup, 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 dup. I mean, really common in these older guys that it's not 100% steady. Definitely chest rads would be where I'd be headed. And then obviously we are seeing any changes that would be concerned with the heart.
For an older dog with heart problems, the options can be limited.
We don't want to put her through big operations or big investigations, we wouldn't do that. But it was just a chest X-ray and a pill. You know, we're happy to do it because we want to keep her as long as possible because she's so gorgeous.
X-rays are booked for tomorrow. Catherine can only hope that Tandi's time isn't up just yet.
I don't know how we'll manage when she dies. We'll miss her so much. It'll be terrible. We just can't bear to think about it.
Out on the road, rookie vet Max is on his way to see a spaced-out baby goat who's off his food and behaving out of character.
Little 12-week-old Billy started having a bit of diarrhoea yesterday. Unfortunately, over the last sort of 24 hours, he's just been a bit not quite with it.
It's new territory for Max, who only graduated from vet school last year.
I haven't dealt with any of these sort of neurological issues in younger goats before, so I've got a bit on my hands. How's it going? Good, good. How you doing? I'm Max.
Billy is the youngest of owner Mandy's 3 precious rescue goats, and he had a difficult start in life.
The mother was killed by the hunters, and then they found this 2-week-old baby. So I took him on, and I love him.
She's worried sick about her adopted fur baby.
He wouldn't eat yesterday. He's grain,
Right.
and he's bottles, and he loves his bottles. And this morning was the same. Yesterday had diarrhea.
Right.
He's just not himself. He won't play or anything, so it's definitely, I don't want to get any worse.
Mandy goes to great lengths to provide all the creature comforts.
Sleep on cushions, as you can see, and they got a rain cover. I mean, you know, they do quite well. Just love my goats.
Max tries to narrow down the possible causes of Billy's condition.
What is his diet at the moment?
He's on the grain like the other two.
Yeah.
I give him a little bit of carrot in apple, and he has a morning bottle and an evening bottle.
Okay.
As you can see, they're not very skinny animals. Normally, they like their food around here.
He does have a little bit of a temperature, nothing massively elevated or anything. Let's just watch him sort of walk around and see if he's...
Billy, Billy boy.
We're not really seeing a lot of neurological signs, which is good. So potentially there's something in its gut that's not quite right.
Billy the kid has got Max stumped. It's an unusual case for him in his first year out.
Might actually get on the bell and phone one of the vets just to see what they think.
As Max decides to call for backup, Mandy can't believe the change in her normally outgoing and noisy kid.
This is not his character.
Right, okay.
This is not him.
After the break, could this mother be killing Billy with kindness?
I'm not kind of normal about my animals.
As Max tries to figure out what's wrong with a tiny, pampered goat. What's the matter with Willard?
Something's telling me I may learn something today that I don't want to know.
And what do X-rays reveal about this golden retriever in her golden years? Out in rural Tauranga, new vet Max is visiting a baby goat who's off both his food and his normal playful behaviour.
He may have some sort of an infection going on,
Okay.
but I'll just get on the phone and
Yeah.
see what Kate thinks.
It's a worrying time for Mandy, whose goats are as well cared for as her own children.
I just like to brush them. I know a lot of people just brush their horses and stuff, but actually I quite brush mine every day. They love it because there's certain parts of the body they can't get to. I'm not kind of normal about my animals.
How old did you say it was?
He's 3 months.
Oh, yeah. Is he still on a bottle?
Yeah, yeah.
With milk?
Yes.
Really? Oh,
Yeah.
okay. They probably need to start thinking about weaning him because he's probably not digesting that well.
Kate suspects that Billy is now too old to tolerate milk.
Probably shouldn't be on the bottles at this age, but I'm kind of like spoil them.
Max just has to break the news gently to Billy's loving mother.
Might be time to start weaning off the bottle a bit.
He was on 5 or 6. Now he's on 2. because he cries out for it.
Yep.
too.
And then at the next, week or two, wean him off that completely.
So no bottles.
No bottles.
Just on the ground.
Yep.
Max prescribes some shots to set Billy right.
So we're just going to give him some vitamin Bs, and then we've got some penicillin, and hopefully that will help with the gastritis that he may be having, and potentially any other infection that he's got at the moment.
There you
There you go.
Good boy.
And there's some final advice to keep Mother Mandy in line.
We'll just keep him on a good nutrition with a good bit of grain.
Yeah.
Hopefully with the weaning, he'll take that over. Okay.
While Mandy will take good care of Billy, her husband knows his place in the pecking order.
The goats get fed at 4 o'clock every day. we don't get meals every day.
It's so true,
Goats get
though.
looked after, but
Yeah, he's way down. Yeah. The goats, the dogs, the cat, the children.
yeah.
I think they're older now. And him.
Max will be back to check on Billy in a few days, but will Mandy be able to keep her mothering instincts in check? Yesterday, vet nurse Kylie's beloved cat Willard came into the clinic with a mysterious lump.
Hello, my darling.
His test results are back, and they've revealed an unusual problem: feline leprosy, a microbacterial disease that causes small lumps to form under the skin.
He has been diagnosed as having leprosy, so the plan for today is hopefully take that lump off his nose, and then he'll be in for a long-term course of antibiotics.
Luckily, feline leprosy cannot be passed on to people or other cats, so the rest of Kylie's pride is not at risk.
Hey, Willard, boys.
Kate and Kylie are worried about Willard's rapid weight loss. They're concerned he might also have feline AIDS.
We're going to take a sample of blood from him, submit it to an in-house feline AIDS test. It's kind of like a pregnancy test, so it'll come back with 1 line or 2 lines, so I'm hoping it's going to come back with just 1 line. I'm just trying to remain brave, but something's telling me I may learn something today that I don't want to know. 1, 2, 3.
Like HIV in humans, FIV affects the immune system, and a positive result could mean Willard won't respond to treatment for leprosy. The result of this test could be a matter of life and death for Willard.
If the result came out positive, I would be thinking down the lines of putting him to sleep. But I don't want to do that, so fingers crossed.
Righty-ho. Off you go.
Meanwhile, GP Catherine has returned with her elderly golden retriever Tandi.
Morning, Catherine. Hi, Tandi. How are you?
Tandi is here for her x-rays, which should reveal the cause of her excessive panting. Both Catherine and Tandi are feeling a little separation anxiety.
I just hate it when she cries like that. She's just so much one of the family. I feel like you're leaving your child crying away in the corner. It's awful. So yeah, I'll be thinking about her all day long.
Okay, let's go, darling.
Once sedated, Tandi is a model patient for her x-rays.
Good girl, Tandi.
But Holly has made an unwelcome discovery.
I'd be pretty concerned. Look at the size of her heart.
Coming up, Kylie's precious pet goes under the knife.
See, look at this. What is that?
Has Mandy managed to keep her maternal instincts in check?
Come on, Billy.
And has Tandi become too big-hearted to go on?
Is this going to be like terminal illness?
At the Tauranga Vets, several anxious mums are worried about their furry family members. Vet nurse Kylie is nervously waiting on the result of a feline AIDS test for Willard.
My eyes, I'm feeling like are tricking me, and I feel like I can see a ghosty pink line turning up.
The test will show 1 line for a negative result, 2 lines for positive. So far, only one line has appeared.
So far, so good. Don't get too excited yet.
And before long, Kate is able to confirm the good news.
So it looks like it's a negative then.
Yay.
But it's not over yet. Before his operation, there's one more test for Willie.
So ultrasound's got the potential for showing up some nasty things which could significantly change his outcome and his overall prognosis.
Stomach. Just cold on your tummy.
Kate searches Willard's abdomen for abnormalities.
Everything looks pretty normal in there to me.
Good.
Kate now suspects the weight loss might be due to a bit of kitty competition at home.
I might just need to look at feeding him separately from the others, just seeing if he's getting pushed out.
Kate can now proceed with the operation to remove the lump on Willard's nose, a particularly sensitive area.
I haven't done any facial surgery as such like this in terms of trying to close a wound on the nose specifically before.
She starts by shaving the area around the lump.
We don't know how far we're going to have to go.
Until Kate starts to remove the lump, she has no way of knowing how far it has spread beneath Willard's skin.
I have utmost confidence in Kate, but I still feel a bit nervous about him. 'Cause he's my baby.
I need to go onto the bone, I think. It's going a bit more.
Yeah.
See, look at this.
What is that?
Down the hall, Tandi, the golden retriever's x-rays, have given Holly cause for concern.
It looks like there is some enlargement of Tandi's heart. Normally our airway as well comes in and then drops down, whereas we're seeing that it's pushed up or elevated there. The heart itself is very, very rounded.
Dogs are increasingly at risk of an enlarged heart as they age.
You've got to remember the heart's a muscle, so as it gets older, everything starts to loosen and stretch. All your valves aren't necessarily closing as well as they should be, and it's not able to push that blood forward and round. Good, yep. She's probably okay.
Tandi's mum has come in to pick her up.
I can't wait to see her.
Oh, here we go, darling. Tandi, wait a second.
After the happy reunion, Holly has to let Catherine know that her GP instincts were unfortunately correct.
The heart is just a little bit enlarged.
Yeah.
It's not pumping as well as it should be anymore.
Is this going to be like a terminal illness?
I guess that's the thing is once you're on the path, you're on the path. You know, to be honest, 13's already really good for a retriever. It's quite a hard prognosis for a lot of clients to hear that their dog is potentially in the early stages of heart failure.
It isn't a good diagnosis to get, so it is a bit upsetting, really.
While the heart disease isn't curable, Holly recommends a course of treatment for the symptoms.
Okay, gorgeous lady, you're all done.
Tandi's still got some time up her sleeve.
She's such a lovely dog. Hopefully you can get at least another year or two.
And Tandi can live out the last of her golden years with her loving family.
Okay, so it's got mild ulcerations.
Back at the operating table, Kate is trying to extract the lump from Willard's nose, but it's a particularly difficult area to work in.
It's not well defined, so having some trouble determining where to start and when to stop. Oh dear, this is not very nice. I'm just cutting out what I can cut out, and that's as best as we can do.
Yeah. I guess we don't see that many cases of feline leprosy, so it's kind of weird.
We've got the majority of the lump out. At this stage, we're just doing what we can do and realise that there's still going to be infection in here, but that's the job of the antibiotics to hopefully help cure that.
It's the closing stages of the operation, and Kate puts the finishing touches on Willard's nose.
That looks beautiful, Kate.
Yeah, it's actually come together really well. He is done.
You gave him a really good nose job, Kate.
Oh, hello, signs of life.
Thankfully, Willard's prognosis is good, and no one is happier about that than Kylie.
Hey, don't bite, my darling.
Oh! It was a sneeze. What we're going to do from now is just give Willard heaps of antibiotics. Tonight, he'll come home with me. He's going to be kept nice and quiet. He's got a cone on. No doubt the other cats will give him a bit of grief about that.
Okay.
Max has returned to check up on Billy the kid, the small goat who was way out of sorts.
Hey Mandy, how's it going?
How are you? Come on, have a look.
Look at him. He's looking fantastic, isn't he?
Fabulous. Hey, Billy, you're fabulous. Come on.
Billy is full of beans and back on his food, but thankfully not back on the bottle.
Look at him go, he's much better, isn't he?
On the Saturday, he still wasn't eating that well, but on the Sunday, I started seeing improvement. And then by Monday, Tuesday, he was back to normal self.
Oh, that's fantastic.
Yeah, fantastic,
Yeah.
And he's not on any more bottles. To my disgust. Because he's my baby, you know.
Mandy's little kid is growing up, but she hasn't been able to give up all of her pampering ways.
Come on, Billy. He likes for me to hold it sometimes for him. I have a little spoiled, you know. Yeah. Billy, here it is, darling. Here. There we go.
Next time on Pet Medics, Max attempts his first ever amputation on Action Cat Nancy.
I am nervous, but hopefully it'll go all right.
Holly has a helping hand diagnosing 3 sick calves.
He never had bung eyes, but he's got bung eyes now.
And Kate fights to save the life of a young pup with a badly swollen tongue. But is she too late?
Pretty bad, isn't it? I wish I'd bloody seen it earlier.